Good morning, everyone. I'm Sayukta from beautiful Spotless Scale team. I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern, especially for girls in their 20s. However, people with PCOS can have a wide range of symptoms and clinical signs. Acne is common, affecting 10 to 34% of people who have the condition. To many, acne is also known as blemishes, blackheads, whiteheads, pimples, and so on. So today we are going to talk about acne management and PCOS. Although acne most commonly does not have any serious health concern, but is de-stressing for the sufferer, the faster the issue is diagnosed, more effective will be its treatment. Thus, knowing about acne management and the connection between PCOS and acne from an expert is essential. For this, today we have Dr. Shobha Reddy, a consultant dermatologist from Hyderabad, live with us to educate us more on acne and PCOS. Dr. Shobha Reddy is a dermatologist in Dilsukhnagar, Hyderabad, and has an experience of 14 years in this field. Dr. Shobha Reddy practices at Dr. Shobha's Skin and Hair Clinic in Dilsukhnagar, Hyderabad, and another branch is at Mehdipatnam, Hyderabad. She has completed her MBBS from Gandhi Medical College in 2003, post-graduation in dermatology from Gandhi Medical College, Hyderabad in 2008, and DDVL from Gandhi Medical College, Hyderabad in 2010. Today, Dr. Shobha Reddy will share with us each and everything on acne and PCOS. A very good morning to you, Dr. Reddy. Hope you're doing good, ma'am.
Yeah, very fine introduction. Thank you, Samyukta, for the nice intro.
It's a pleasure to have you
all.
Yeah, thank you. And it's a pleasure to have you with us, Doctor. And today we are going to cover a very important topic, acne and PCOS. So acne in connection with PCOS. So to begin with, we will first like to understand what does PCOS means, what are the causes of PCOS. So in general, we would like to understand what PCOS is.
Yeah, it's a very good question, Samyukta. People will get confused with what is PCOS and what is PCOD. See, PCOD is just having small cyst in the ovaries. That is polycystic ovarian disease. PCOS is the PCOD with the clinical complaints of metabolic syndrome. So PCOS is completely different from the PCODs. That means PCOD, all the PCODs may not have the PCOS. That is, they don't have the metabolic complaints like acne, unwanted thick hair, and pattern baldness. So PCOS is a syndrome which concludes PCOD along with the clinical hyperandrogenic symptoms such as acne, which is a more common in the middle-aged women, and along with the pattern baldness. So PCOS is different, PCOD is different.
Right, because normally we hear a lot and talk a lot about PCOD, but today at least we'll understand what PCOS is and what's the connection between PCOS and acne. And doctor, what are the causes of PCOS?
As such, there is no correct etiology for the PCOS, but we have to check the strong family history of PCOS in the mother side and sometimes even the grandmother side also. And that is a genetic history is a very important thing. And the second thing is the environmental factors such as how there is lifestyle and how is their diet and how the if they are obese kids and the very bad lifestyle, that is also one of the important factors. So basically, two things are very important to know: the family history of PCOD and at the same along with the metabolic symptoms and the environmental factors such as diet and lifestyle changes. So we can say genetics along with the environmental things.
Okay, and if I say these are also the people, then those who are prone to having PCOS or are at risk of having PCOS. So is this correct, or there are other people else also who are at risk or who can get PCOS?
See, to some extent, if you take the proper history, if the mother is having the PCOD problem, if they are having the history of irregular periods along with acne in their teenage, we can, to some extent, we can conclude the genetic component. At the same time, how is their lifestyle? So by asking about the lifestyle, we can explain about them how we can prevent the PCOS. See, PCOD, even if it is there, if they are able to control the diet and lifestyle things, they can it is not going to become PCOS.
Okay. And as today we are going to talk in detail the connection between PCOS and acne, please shed some light over it, doctor.
Very good question. See, most of the time, people will think that acne will go with the topical creams and some oral antibiotics. But if it is not going with all the treatment for a longer time, that is, it is persisting for the longer time, especially in the middle-aged woman, then we have to think about the hormonal acne. It may not be PCOS, some other hormonal things will be there, but most of the time, about 80% of the cases are PCOS symptoms. Okay, then see one thing, if it is not subsiding with the topical creams, if it is not subsiding with oral antibiotics, it's 80% maybe the hormonal thing. That time you have to take the proper history where we have to consult the dermatologist. They will ask very few questions. They are very important. Whether one thing is regarding the acne, whether the acne is coming very suddenly, and if the acne is persisting for the longer time, even it is not responding to your conventional treatment like the topical creams which I advise, that time we have to suspect the hormonal acne. And that if you think if it is hormonal acne, we have to check for the other history. If they are getting very thick coarse hair on the upper lips and chin, and if they are losing the hair, especially on the frontal part, and how about their periods? If the periods are regular, are they coming every 2 months, then we have to suspect the hormonal component, which is very important to rule out mainly the PCOS thing we need to rule out. And any infertility issues also, they are not conceiving. So all those things come to conclusion about the hormonal thing. So the history is very, very important. And if you think the history is concluding to the hormonal component, then you go for the proper examination. See, if the person comes to you, then we have to see whether acne is more on the lower part, on the lower face with a lot of tender nodules, and it's absolutely severe component, not like normal comedones. Then we need to think about that component and check for the hairy hair on the upper lips and chin, not the fine hair, the thick coarse hair, which is very unusual for the woman. That time we have to think about the hirsutism component, which is also component of hormonal acne and even the metabolic syndrome. And at the same time, pattern baldness. So all these things we can conclude to some extent by the proper history and the clinical examination. If you check the person's body stature and check the body weight and calculate the basal metabolic index, that is according to the weight and height, then if you think if the BMI is more than 25, we can consider it as a obese PCOS, along with the other symptoms what I explained.
Yes. So we can say that, all these things are actually symptoms or maybe the symptoms of PCOS. So if we have these symptoms, irregular periods or acne outburst, and it's not getting treated anyways, and, some hair loss in the frontal forehead or facial hairs, those are very coarse and harsh, then we should actually be concerned and go and check with the doctor. Now, the thing is, doctor, if we are having acne, we don't know for what reason. A, we will get it treated, and B, if it comes out to be acne due to PCOS, is there any change in treatment modality of PCOS acne caused by PCOS?
Change in the treatment is the first thing is what we can do from the patient side, what we can do from the dermatologist side. So first things, because PCOS is like a metabolic syndrome. It's not like a only we can treat just with a medication, because the counseling plays very, very important thing. That's why the diet and lifestyle is the first mode of treatment in PCOS. So explain about the diet importance, proper healthy diet, and proper lifestyle, physical exercise, and stress relieving things like meditation, yoga. These are very important from the patient point of view. And from the dermatologist point of view, you already know it is not responding to the topical things and not other oral medication. Then you can start the hormonal oral contraceptive pills, especially for the recently married women if they doesn't want to conceive, but already they are suffering from the infertility issues and they want to conceive. So we can't give that time, we can't give the oral contraceptive pills. That time we can go for other alternatives like myoinositol based powders or tablets. To some extent it will help, and go for the procedures like comedone extraction, other things along with the hormonal treatment. And if the coming to the young people, like going to get married, for those type of people, we can start OC pills straight away, explaining about the importance of the medication. And one more important thing is we have to tell the patient to use it for minimum 9 months to get the response. So there is nothing wrong to start the oral contraceptive pills. If you are convinced it is a hyperandrogenism, that is both clinically, sometimes if you are not able to conclude, we can go for biochemical investigations where we will see a lot of parameters which I explain in the next things. So if you convince if it is hyperandrogenism, then we can go for the oral contraceptive pills. This is the first important thing. And one more important thing is the insulin resistance. We need to tackle the insulin resistance. So we don't know, we can't, most of the patients don't know what is meant by insulin resistance. That time we can explain how it looks. Some people will be very obese, and some people will be lean also. And lean people also, they have some light thickening of the neck, that is dirty neck, or most of the people will think that it is because of the gold or something, are not proper cleaning. It is not that one. It is called acanthosis nigricans. That is a sign, or that is a clue for the insulin resistance. That time we need to start the metformin. After doing the HOMA-IR ratio, that will come only with the proper investigation like fasting insulin, fasting blood sugar. So metformin along with oral contraceptive pills is the baseline treatment for severe not responding to the oral and topical antibiotics, even with a diet and lifestyle changes. These two things are very important.
Okay, so you very well explained the, life of treatment for acne caused due to PCOS. Now the thing is, doctor, when you as a doctor try to diagnose the cause, are there, you said that we investigate the history, that's one thing, but are there other lab tests that you do?
Lab test is very important, because especially for the young people, because we can't do the ultrasound to diagnose the PCOD for every woman, because the PCOD will be diagnosed only by the transvaginal scan, which is possible only for the married woman. So for the young kids and adolescents, where will get confused. See, most of the time it may not be PCOD picture, won't be there even in the ultrasound or transvaginal scan also sometimes. That times of basic blood parameters, which I explained in the previous question. That is, basic thing is you have to check the fasting insulin levels, fasting blood sugar levels, total testosterone. These are the basic 3 things we need to know. Once you know these 3 things, to almost 50% of the clinical hyperandrogenism, what is meant by that one is increased levels of the total testosterone in your body. And at the same time, insulin resistant, where the insulin will be, there is a lot of insulin in your body, but it is not helping you to take care of your carbohydrate metabolism. So that is those things we can diagnose by the biochemical investigation. That time we can straight away start the treatment. So these parameters are very important. And for married women, you can go for the transvaginal scan, where the most of the time it will detect the PCOS morphology.
Okay, so doctor, now at least we understand what is PCOS, how is it different from PCOD, and how PCOS is responsible for acne and other, symptoms and signs in our body, and what are the treatments available for treating that. Now, as we'd like to talk more about acne and other, reasons responsible for acne, etc., is there anything that we are missing out on PCOS and acne, the connection between them? Anything that you would like to tell us? Then we can proceed to other acne-related questions.
Yeah, actually, most of the time, middle-aged people, we can diagnose PCOS it's a very easy thing to diagnose. But for the young adolescent people, you have to keep in mind about the congenital adrenal hyperplasia, because some people they get prepubertal acne also, because the puberty also will attain very early. Those people keep in mind about the adrenal cause also, because every hormonal acne in adolescent may not be PCOS. Sometimes other causes like 11 to 20% may be the adrenal causes also. like congenital or non-congenital adrenal hyperplasia. So think out of the box and think about the adrenal causes also. There we can go for the further investigation like DHEA, androstenedione, and other engine. They are higher end investigations, but even the CT, if you think it is not the PCOD, and if it is going beyond that one, like other symptoms like weight gain, Cushingoid features, the puffiness and hirsutism, and people are not going in the height, short stature, those times we can think about the adrenal causes also. So, but 80% it is PCOD, and most other things, some 11 to 20%, we have to think about the adrenal hyperplasia. And very rarely, adrenal tumors will be there, but that's a very rare thing, especially in Indian scenario. Most of the time, PCOD is the most common thing. So think about even the adrenal cause is also one of the reason for acne. In that way, also we can exclude other systemic issues like adrenal hyperplasia and adrenal tumors, sometimes even ovarian tumors also.
Okay, we always say the early we detect, the more easy treatment will get, and more good for us, because in a very less time we'll get the treatment and get relief from whatever condition we are into. Now the thing is, can we take irregular periods as one of the symptoms or big sign of PCOD or PCOS, and go and check with the doctor so that we can actually maybe will be able to safeguard us from having acne breakouts or other complications which are many a times PCOS is responsible for. So is it a good thing to do? I mean, maybe if we are having irregular periods only and no other symptoms yet, we can go and check with the doctor?
It's a good question. It's one of the sign of ovulatory dysfunction. See, ovulatory dysfunction can be present as irregular periods. It can present as infertility issues. It can present as oligoamenorrhea also. There is nothing. There is no periods. So that time we can think about, even if they are not getting acne. So we can, if you think if the irregular periods over the longer time, we can suspect the PCOS. And we can, because future so basically why we have to diagnose PCOS very early is future complications can be prevented as early as possible. Because just not think about the acne or infertility or even the hirsutism or the thick hair. Think about the other metabolic issues, like even the cardiovascular component, even the diabetes also may be more frequent, and in more of metabolic problems will be there in PCOS. So definitely, if the periods are coming not regularly and there's a prolonged amenorrhea, nothing wrong in going for the investigation.
And doctor, as we always say, prevention is always better than cure. Anything that we can do, from the start, from the beginning, to prevent PCOS and the related complications, and of course, acne.
I didn't get, sorry.
Yeah.
Can you repeat the question?
Yeah, I said that we always believe in the phrase that prevention is better than cure. So anything that we can do to prevent this condition of PCOD or PCOS from the beginning, from the start.
Two things we can say here is, if you think there were already family history of acne is there, and the family history of irregular periods, they suffer from the PCOS. We can advise to the kids or children or even the young people. They can change some lifestyle changes. They can be strict to the diet, so that way we can prevent the PCOS to some extent. But we cannot rule out the genetic component, but the environmental things, which is the main etiological factors in the PCOS, we can prevent to some extent. So
and how far
the diet and lifestyle is a main part of the treatment of PCOS.
Exactly, I was coming to that only, that how far a good and healthy lifestyle, balancing, maintaining a good body weight, eating healthy, drinking healthy, sleeping well, how far these things contribute in prevention from PCOS?
These are very, very important. Why? Because the way we are targeting is targeting the insulin resistance, otherwise called hyperinsulinemia. These things, if you are able to target, or if you are able to reduce the insulin resistance by good lifestyle, good diet, we can able to reduce the even hyperandrogenism. That is because most of the time the testosterone levels will be elevated. One of the main factor for the insulin level, androgen levels in the body is because of the insulin resistance. So some way the lifestyle changes is making to control the insulin resistance that is going to affect your hyperandrogenism, that is increased testosterone, which is the reason for acne, hirsutism, and even the pattern baldness. So definitely that plays very, very important role. It is very important for the adolescents actually.
Right. So maintaining a good lifestyle is very important. Eat well, drink well, sleep well, do exercise on a regular basis, and stay happy. That's really important. And in case you have any history in your family of acne or PCOD or PCOS, or you yourself is going through some changes, some hormonal changes or things that's bothering you, please don't waste time. Go and consult your doctor. And in case you have acne, do go and consult your dermatologist as soon as possible. Now, we had already spoken about PCOS and the connection between PCOS and acne. Now that's clear for us. Now we would like to move a little ahead and talk about acne in general. Because see, acne, especially for women, so I'm not saying that men don't have it, men also have it, but especially for women, especially during puberty, adolescence, and even after that, acne is a very big concern. And people are always wondering, what to do. They just go for home remedies, or they'll do some surfing and find out some over-the-counter gel to apply, etc. How far these things can help in the curing those acne?
As a dermatologist, I strongly disagree the home remedies because we don't know which is suitable and which is going to cause the allergic thing, and which is going, the basically the homemade products, it may clog the pore. So the basic component, when is the pore blocking is there, acne will be more. So acne flare-ups will be there and breakouts will be there. Sometimes there will be irritant dermatitis. Not only acne will flared up, even the irritant dermatitis will like haldi. See, most of the time housewives, what they will apply haldi and they will apply honey. And some people, they will go apply tomato also. These things, it doesn't suit for all the people. And I strongly discourage these type of practices because this is not going to solve your issue sometimes. But sometimes it may cause harmful to your face also. So basic reason that scomadogenesis will be get aggravated by using homemade products. So don't use or don't try on your face. It may hurt and it may lead to pigmentation also.
And how about the over-the-counter medication? Talking a friend about what issues you have, and using her or his prescription for your good. How far these self-medication, over-the-counter medication goes?
Self-medication, if they don't use properly, see, one example, they will tell about the topical retinoids. They don't know when to use. If they use in the morning time, it may lead to a lot of burning and irritation. And if they don't use without the moisturizer, that actually aggravates the problem. And self-medication, it's not advisable, especially with adolescents, because they are in a hurry, they don't use properly, that will aggravate the problem and think that this is not going. So that's why I have to go back and I have to change to the home remedies. So all this is like a vicious cycle. Better not to take the self-medication.
Yes. So please stay away from over-the-counter or self-medication. Stay away from home remedies. Go and consult your dermatologist in case you have any skin-related problem. And doctor, we also say that, it's important to have a regular daily skin care routine. Now, but people also have this, problem or complain that I have such a hectic life. How should I go for a regular skin care routine, especially for the acne prone skin people? So please advise a very simple skin care routine that all of us can follow, especially those who have acne prone skin, how to maintain a healthy, glowing, acne free skin.
Yeah. In this busy world, three things are very important. However busy may be, three things are, but is a proper cleansing, especially for the acne prone skin and the sensitive skin. It should be the gentle cleanser. And check for the pH of the cleansers. It should be, at least it should match near to the skin, that is around 5.5, and should be mild cleansers, not like very harsh cleansers. And if the skin is very oily, like seborrheic face, and even they have dandruff, and even they have the lot of oily face, and especially on the T-zone, we can go for salicylic based face washes. So that is a cleanser. So cleanser using twice daily is minimum. And if the skin is very oily, you can increase the frequency also. This is the first thing. And second thing is the using the good sunscreen in the morning time for all the people, whether they're working or not working. But that should be, especially when it comes to the acne issue, it should be non-comedogenic, oily free, and it should be skin friendly. See, it should not make your skin more greasy, and more, it should not block your pores. So the second is a sunscreen, and the evening good moisturizer, and along with the medication advised by the dermatologist for the acne prone skin. So three things are must. One is the good cleanser and good sunscreen and a good moisturizer to maintain your skin barrier. These are the three things everybody has to use to protect your skin, not only from the pigmentation, even for the to maintain your barrier also. So three things are very important.
Right. So it's important to cleanse our skin properly. It's important to apply sunscreen daily. It's very important, and moisturize our skin in the evening. So this is a very easy, it's a very pocket friendly and time friendly thing that we all can do and we should do. Now the thing is, doctor, as you said, cleanser is very important and an integral part of our daily skincare routine. Now, especially people who have acne prone or oily skin, they have this tendency of washing their skin every now and then. There are people who will keep on washing their face with a face wash or a cleanser every 2-3 hours, and they still complain that my skin is anyways oily, and I don't know what to do. So is frequently washing your skin a good thing?
It's very important and very good question, because see, two things we need to maintain the barrier. So repeated cleansing, it will remove the protective thing. So keep on cleansing is not at all advisable. And one more thing, don't use the harsh cleansers. People will think they have oily face, so I have to use scrubbers or even the very salicylic based things. But the thing is, keep on washing the face very frequently, every 2 hours. So some people will have some, this I have encountered with my patients also. So better not to use too frequently, but daily 3 times for the excess oily face is always solve the problem. Only thing is, you have to consult the dermatologist, not growing, don't use your self-medication, because they will check your skin by using the dermoscopy, whether the skin is very oily, combination or dry skin. According to that, they will guide you which cleansers you have to use. If you think if it is very oily, you can go for salicylic acid. If your skin is very sensitive, like rosacea skin, because some people will get red even just using normal cleansers, that time we have to go for the strict sensitive cleansers. And if the very dry skin, use a moisturized based face washes. So always consult the dermatologist. They are the right person to diagnose your skin condition.
Right. And with sunscreen, again, people have a lot of complaint. These statistics says that in India, 67% of people are still not using sunscreen, despite knowing that, how hot and humid our country is. But still, they won't use sunscreen and say that, sunscreen produces more oil. It makes us sweaty. It makes us more acne prone. It makes my skin dull and patchy. How to address that?
Yeah, so very important for Indian scenario. See, people will think that the first question what they will say is, I'm staying in the home, so I don't need the sunscreen. The first thing, that is very wrong. Even the rays coming from the tube light, even the rays releasing from the screen also, they will cause lot of tanning and lot of photo aging over a period of time. It's not a instant thing. It will because of the cumulative accumulation of the photo damage, it leads to aging pattern. So every person should use the sunscreen. It's a routine part of their lives. It should be like their daily routine. And the second thing is, most of the time, if you apply, take time to apply the sunscreen, not in a hurry, and not to rub into the skin. And people, we have to, as a dermatologist, will tell the patient how we have to apply the sunscreen. If you see check the sunscreen and check the skin. If you advise a sunscreen, we have to tell about how many units we are using, how much you are using. That is the first important thing, is how frequently you are applying. Second thing, and how it should be like not rub into the skin, and always stick onto the 2.5 fingertip units it may not be practical for every person, but try to tell that you have to use a good amount, not like a beauty cream, like a small pea size or very little amount. It's not going to help. This is not a beauty cream. This is a part of your treatment. It's a part of your daily routine. So sunscreen is always beneficial. Only thing is how you are applying, how much quantity you are applying, how frequently you are applying. These three things we have to tell. And once you tell, simple thing I will tell to my patient is, we can see a lot of difference who have applied the sunscreen, who have not applied the sunscreen over a period of 5 years, because some way it is able to reduce your aging pattern also. So that's why that is one way of explaining about the sunscreen usage. And try to, as a dermatologist, it's our duty to explain about the uses of sunscreen and how frequently, how generously they have to apply.
Right. So it's important to apply sunscreen daily. Reapplication is very important. How much amount you apply is very important, and choose your sunscreen as per your skin type. And if you're not being able to do that, go and consult your dermat. They'll guide you on that, because they'll know, what is your skin type and how well one sunscreen will work for you. So please start using sunscreen if you have not yet. I'll pick some of the questions that our viewers are, pouring. Ankita Mehra, Asha Thakur is asking, or I'll take Radhika Sain's question, because her question is a little closer to what we are talking right now, sunscreen. So Priya Sharma is asking, should we use sunscreen even in the monsoon?
Yes, it's a very good question, because sunscreen you have to apply throughout the year. Why? Because even in the monsoon also, UV rays able to penetrate the clouds also. So there is no season for sunscreen usage. You have to apply throughout the year.
Okay. Suman Yadav is asking, what are the first signs of PCOS?
PCOS signs, there are no first and no second thing. It may occur as a single thing. It may occur as a conglomerate of 3 or 4 components also. But check always if you are getting sudden acne, even your periods are irregular. That means not coming within 20, either coming very less than 21 days, or not coming more than 45 days, or sometimes we can calculate less than 8 cycles per year. Even that is also one of the sign of anovulation. And if they have infertility issues, and other 2 components, that is hirsutism, thick hair, and even the pattern baldness also. So there is no first sign or no second sign. It may come as a single symptom also. It may come as a group of symptoms also.
Okay. Asha Thakur is asking, how does my diet affect my skin?
Diet is very, very important thing. Is 3 things we have to think. How is your diet? Whether it's you are taking only processed foods, that is very important, because that is one of the reason for the most of the insulin resistance nowadays in the young adolescent people. So first thing is, don't go for the refined foods, and follow the proper Indian style food. That is always advantageous. That's why if you see Western people diet is more harmful compared to the Indian style diet. So stick to your Indian style diet. And second thing is, improve your lot of fruits and vegetables which are bright, which will improve your oral antioxidant, prevents accident damage in the skin. So you should have fresh fruit, avoid processed foods, avoid refined sugars. This is always beneficial.
Okay. Rachna Rohit Srivastav is asking, I'm having acne on my face, and for 3 years, I'm having this problem, that too very big. I have done many treatments, but it is not getting better. What should I do?
Actually, from the last 3 years, what you are using is very important. What medication, whether you are using only the topicals or whether you are using just the topicals and oral antibiotics. And I need to see your skin, and not only the skin, I need to check your body weight, height. I need to calculate the basal metabolic index and any other signs of insulin resistance. Sometimes we can diagnose insulin resistance clinically also. And if I'm convinced that you have lot of acne is associated with the hormonal component, then I will straight away start the go for the investigations like total testosterone, insulin levels, and FBS. Then afterwards, If I am convinced, if you have insulin resistance, if your testosterone levels are high, if you are married, and if you doesn't want to conceive, we can start the OC pills. And if you are not married, and if you are going to get married, we can start the OC pills straight away. So all this depends upon at what stage you are, and what is your body weight, and what is your marital status. All these are very important before starting the treatment.
Fair enough. So, Rachna, if you are based out of Hyderabad, please go and consult Dr. Shobha Skin and Hair Clinic at Dilsukhnagar or Mehdipatnam, and consult Dr. Shobha Reddy. She'll help you. Otherwise, if you're not in Hyderabad or not being able to go there, please consult your nearby dermatologist. That's very important. Pooja Pandit is asking, Doctor, that I have PCOS and fatty liver. Should I consume protein supplement to lose extra fat, as according to my body type, I should consume more protein?
Sorry, fatty liver.
Yes, fatty liver and PCOS, both. Now, as she has been advised to consume more protein, she is asking, can I take protein supplements?
I don't advise to take the protein supplements because already you are having fatty liver, and even the fatty liver is not the sign. It's just a symptom. We have to analyze your liver function test, because if you have acne along with the fatty liver, we need to see other components also. We need to check your enzyme levels in the liver, and how about other things. So if they are not significant, if they are significant, not to start any tablets, like even the isotretinoin and other things. If I want to start, your liver should be perfectly normal. See, whatever the medication we advise or any doctor advise, it has to go through the liver to remove from the body. So liver should be perfectly normal, and there should not be any obstructive cause. There should not be any physiological thing why the fatty liver is there. So why the fatty liver root causes we need to see. So consult a good gastroenterologist the reasons for fatty liver. And I don't advise protein powders. God has given so many proteins for us. You can take orally.
Exactly. Have a balanced diet. The Indian thali, as doctor just mentioned, it's full of, micronutrients, macronutrients, protein as well. If you are a vegetarian, then again you have, paneer or dal, etc. Lettuce, leguminous foods. So go for it and eat healthy, stay healthy. Now, doctor, as we are talking about that, how important it is to cleanse in your face, apply sunscreen and moisturizer, many people do also ask that, see, I have an oily and acne prone skin. Do I need to moisturize daily? Because moisturizer will end up, making me more oily. So what's the right thing to do?
It's a tricky question. If you have only oily skin, if you don't have acne, you can use a very mild moisturizer. And one thing is, if you want to start the treatment for acne, you always better to choose a moisturizer, then followed by the topical creams. Because why the acne is also one of the barrier damage disorder. So always maintain the barrier. That is nothing but proper moisturizer. But when you are choosing the moisturizer, don't go for the over-the-counter products. Always consult the dermatologist, because some people, even they are oily also, if they don't use a moisturizer, the breakouts will be more. So always analyzing the skin by the dermatologist, because they know your skin much better. So don't try any moisturizers on yourself, because moisture is always beneficial. But what kind of moisturizers we are using is very important. See, there is a lot of advances came in nowadays. There are a lot of technology. It's not only the moisturizer, the technology what they are using. So if you go for the oily skin, the moisturizer use and how it is going to be effective is also different. So always better to use moisturizer, but with a consultation of the dermatologist.
Exactly. So whatever we choose, whether it's the cleanser or the sunscreen or moisturizer, it should be as per our skin type and as per our skin condition. And no one other than a dermatologist can actually guide us the best for that. So please go and consult your doctor before you go and buy a cleanser or sunscreen or moisturizer. So we just need these three things, and they will actually go a long, long way with us. So it's no harm in going and consulting a doctor before investing our money on that. And doctor, is it real that milk and dairy products aggravates the acne breakouts, or it is just a myth? Please tell about it.
It's a little controversial. See, milk as such is not going to cause acne, but most of the studies, especially the Western studies, has proven that milk and dairy products have lot of insulin growth factor promoting things. See, which I told previous thing, like insulin resistance. So, if you already people are obese, already people have insulin resistance, if you keep on using the milk or dairy products, that problem will get aggravated. But we can't skip the milk, or we can go for the slim milk or even the skim milk with but dairy definitely will aggravate the acne if they have already the family history of metabolic problem. So insulin resistance and insulin growth factors maybe get aggravated by the dairy products.
Okay. And one more thing, doctor, because many times, especially people who have oily skin, they exfoliate their skin quite often, feeling that it will actually, take the oil out and make their skin more fresh and good looking and take all the dead skin, dry skin out. Now, what's the truth behind it? How many times can we actually exfoliate our skin?
Exfoliate by the peels or exfoliate by the proper cleanser? I didn't get the question.
Because
by
there are
themselves
various
or by the
products
dermatologist?
available. Yeah. Yes.
See, never use exfoliants by yourself because all exfoliant doesn't suit for every skin. See, some people, hyperseborrhea or even oily skin people, salicylic face washes works very decently and it works to reduce oiliness. But same face wash, same thing you explain. You asked about the family friends are explained, so they are using the salicylic based one. But if the skin is very dry, very normal skin, they will get irritation and they will get lot of other things also. So always the skin nature, depending upon the skin nature, we have to choose the cleansers also. Not every cleanser doesn't suit for everyone. Cleansers we have to choose according to the skin nature and their work style. And other products. So one more thing is, especially the people working people, they use a lot of makeups. For those type of things, oil-based cleansers, even the good cleansers are very important. And frequency of cleansers is very important to avoid comedogenic. So there is a lot of factors when you are choosing the cleansers. Are you staying in the house? Are you working in a very industrial things where the makeup is very important thing? And the second thing is how frequently you stay outside, how much time you stay outside. So all this counts when you're choosing the cleanser.
Okay. And doctor, as we are moving towards the conclusion of this session, any takeaway, note or message for our viewers?
First of all, thank you, Samyukta, for the nice and good knowledge. And very promptly you asked the first thing. And the second thing is never neglect the hormonal acne because that is going to leave a lot of scars on your face. Come early as possible, and especially in the middle-aged people because that age is the most neglected part. People will think that acne will come and go. No, it is not going to go. It may be the sign of underlying disease. Think beyond that one and always treat as early as possible, and nothing wrong in using the hormonal things. If you have PCOS, nothing wrong in that because in some way it is going to protect you from other things also like cardiovascular issues, even the diabetics history. All these people who are pre-diabetic, we can stop at that stage. So it is always beneficial. Maybe acne is a component of the systemic disease, what is happening in your body. So never hesitate to consult the dermatologist if you think it is not going to solve with the oral medication or even the topical creams.
Right. Thank you so very much, Dr. Shobha Reddy. It was wonderful hearing you, and it was a very informative session for our viewers. We really look forward for many more such sessions and for our viewers in coming times. Thank you once again.
Thank you.
And viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Thank you. Have a great day ahead. Goodbye.